Today, the podcast is Rockin' Out Bro Hymn by Pennywise. I find music to be one of the ways that I cope with my grief. This was a song that my son played over and over again in our garage when he was a teenager, and every time I hear it, it makes me smile. Enjoy the music, and I encourage you to start creating your own ways to cope with grief. Welcome to Grieving Insomniacs. I am your host, Cristi Haberman. I am glad you're here. Thanks for being a part of our community. A few disclaimers before we get started. I am a licensed therapist. However, this podcast is not to be considered mental health therapy or counseling. It is for entertainment purposes only and is not associated with my counseling practice, Cristi Haberman Counseling Services. Thanks for showing up. Welcome to Grieving Insomniacs, episode 6. In part 2 in our series, taking a deep dive into the guilt that grieving mothers often feel after the death of a child. Over the past 10 years, working with my own grief and working with the grief of many others in my counseling practice, I am convinced that when you lose a child, it's almost always unexpectedly. It creates what's called traumatic grief. And what that means is that you have trauma symptoms along with your grief. And that was most certainly the case for me. My son was diagnosed with cancer, but it was a very treatable cancer. So when he died from getting the chemo, after only 3 weeks of being diagnosed with cancer, it was a very traumatic experience. So I think even when parents have children that die from serious illnesses, it's always traumatic to have the child die. I just can't imagine how it would not be, because that's our belief system is that is not the way the world operates. And we learn from this experience that the world is now unstable and it is not safe. And no amount of convincing you will change that belief system, because in that moment, the world became unsafe. The DSM-5 came out last month, and this is the Diagnostics Statistical Manual for Mental Health Disorders. One of those disorders that they have on there is complicated grief. And when I saw that, it just made me very angry, because there's nothing complicated about my grief. My son died. It was a traumatic death. It was not the way that the world is supposed to operate. And I miss him every day. And there's nothing complicated about that. Now, I understand from a mental health perspective, especially if you're a counselor that hasn't lost a child, how it might be complicated for you in trying to attempt to treat someone that's lost a child. But that's kind of the problem, is that we see grief as something that needs to be treated instead of grief being something we experience. And it's very much an experience. And the critical part of that experience and part of the healing from grief is dealing with our guilt we have surrounding the loss of our children. So I talked in the previous episode 1, about our mother's guilt, about how my childhood experiences contributed to the fact that I felt so extremely guilty about my son dying. There was no way to to get beyond that, because those experiences are part of me. They shaped me. And it's difficult, and I understand that it's difficult. But when you're trying to recover from guilt that you have surrounding the loss of your children, you need to take a deep dive into your belief systems. What experiences did you have that contributed to the guilt that you're having right now about the loss of a child? So there is this concept called traumatic grief. And so in traumatic grief, it's that your current grief that you had triggered a trauma experience that you had earlier in childhood. This could often happen with people that maybe they lost a parent when they were a child. And so losing their child triggered the loss of their parent. Now they're dealing with two griefs. I don't believe that children really have the ability, because it takes a lot of logical thinking and making connections between past and present to help you cope with your grief. And I don't know that children have the ability to do that. So they get to be adulthood, and these experiences can be triggered if they've lost a child. And also understand that if the experience was traumatic, which means it was sudden and it was unexpected, you 100% have trauma. And in trauma, your brain gets stuck in freeze mode. And as long as you're in freeze mode, your brain cannot take in any new information. So you don't have the ability to rewire your brain. You're going to have to get some specialized therapy. People do it through yoga, people do it through brain spotting, people do it through EMDR. I know that I personally did EMDR treatment on my grief just to resolve the trauma aspects. I had frequent nightmares. Every night for 5 years, I had a nightmare about my children dying. Even my live son, I had nightmares about, and they died in every way possible. In fact, 2 weeks ago, I had a dream about Christopher. That was a nightmare again. And in this dream, I dreamt that he actually wasn't dead, that he was missing. And I could not find him. And I was looking for him everywhere. And then when I did find him, I realized, oh yeah, he actually is dead, but his body's missing. And that his body had been donated to science without asking me. Some people do that. That's what they want to do. But for me, that was a very traumatic dream. And that dream stuck with me for a couple of days. So I still have the nightmares. I had a lot of anxiety. I still have a lot of anxiety. I had anxiety before Christopher died, but not like I have it now. I replay situations over in my head, doing the woulda, coulda, shouldas over and over and over again about so many things. If I heard a siren or an ambulance, I immediately call my living child to find out if he's okay. That's kind of stopped a little bit. There's a tornado or a blizzard, I call him and ask him what his plans are, if he's going to be safe. I just don't know that that's ever going to go away. I don't know how it could. I've done extensive counseling, various treatments, and I have just come to this conclusion that that guilt is here to stay. And that is something that we carry. So when you're taking a deep dive into, and it's imperative that you take a look at, why do you feel guilty? What is the main driver of your guilt? So when Christopher first died and he had cancer, we lived in California, Vandenberg Air Force Base. A lot of flowers. They do a lot of chemicals, pesticides, and I thought that because we lived there and my husband was in the military, that's what caused Christopher's grief, or caused Christopher's cancer. But that I didn't have that guilt for that long. That went away right away. The moral guilt, feeling like I did something wrong, 100% is one of the major facets of my guilt. Another type of guilt is, and we talked about extensively in the previous podcast, do you feel like as a parent, as a mother, did you make mistakes? Were you questioning what your role is? And if you could have changed it? That doesn't do any of us any good, but I know we do it. Or if your child died in a car accident and you didn't die in the car accident, that'd be survivor guilt. And then there's the guilt we feel about getting better. I've talked to numerous women in my support groups that I attend who talk about they hold on to their grief because they feel like if they give it up, if they lay that burden down, that they somehow didn't love their child enough. And I don't know how to reassure you that your children want you to be happy, that they want you to move on beyond your guilt, because they miss you too, but they don't want you to feel guilty. And that's one of the hardest things, I believe, as a grieving mother, is finding space in your life. How do you make space in your life for grief and for everything else we have to do in our lives? My son died when he was 25, so I didn't have any children at home to take care of. I just don't know how those of you that have young children and one of your children dies, how you can go on. I admire you. I just want you to know I admire you, because I don't know that I could have. How you get up and take care of your children every day, take care of your house, you go to work. And so that doesn't leave much room for coping with your grief. And diving into the guilt, why you feel guilty, takes time and it takes energy. But it's so critically important for you to move on. And move on in terms of being able to carry your backpack of grief with you, without the self-hate that many of us perpetuate on ourselves. I know I do. I know I did frequently. The way I talk to myself, if you heard some of the things that I would say to myself, it's awful. It's just awful. And it's the kind of things that I would never say to another human being, ever, but I say it to myself. And there are days when I think about mistakes actually happened today. I was watching I like to watch YouTube, watch van life videos enough. It's an escape for me. Like, if I could escape my life and if I could travel around the country, I could escape. I could escape from how I'm feeling right now, how I feel today. It's just an escape. And one of the van life people had a child. And I just shut it off because immediately my mind goes back to Christopher and goes back to, I don't know why this always happens to me, but goes back to the mistakes I made or experiences I had. And I just had to shut it off. I just shut it off. Can't think about him being children. I just can't. And I don't know why I'm triggered so much by babies, but I am. It's like this belief system that somehow I caused his death translates into I can't take care of a baby. And it's very difficult. So how do I cope with the guilt? And how can you cope with the guilt? First, you need to understand where it comes from. What is it in your individual life experiences that contributes to your feeling guilty about the death of your child? For me, as I talked about, it was the shame-based parenting. It was the relationship I had with my mother, and not having a traumatic childhood, and not having the building blocks for stability that I needed to cope with the grief. So what is it for you? And I know it's difficult. This is not a process that I did over a month, or it took years and years and years. So I would say I did the EMDR last year. That would have been 10 years. Yeah, so he died in June, and I did it April, May of 2021, so right at the 10-year mark is when I did the EMDR. But up until that point, it was when I was working through my guilt and starting to allow Christopher to take some of his own responsibilities about grief or his death. I let him start being responsible for his death because he played a role too. In fact, some would argue that he played the whole role because there's nothing I could have done differently. So one of the things that I feel most guilty about, and is kind of a struggle for me, is after Christopher's first chemo treatment, he had some complications. And he ended up going to the hospital. And at the hospital, he had 2 friends that stayed with him. And I'm not sure why they stayed with him now that I know what happened. But he died and they didn't notice. They were sitting in the room with him. The nurse had just come and given him some kind of medication. Of course, your mind goes to worst case scenario, which was that you killed him. I don't know. You hear about that. But the nurse came in and gave him the medication. And his friends were sitting there talking and conversing among themselves. And they never noticed him stop breathing. So my question is, if they had noticed, would he still be alive? Because, if I was there, I'd have noticed. I know I would have noticed. And I feel guilty about that. I feel really guilty about that. So you're stuck. So this kind of experience, and I know I have talked to other people out there that says, I had to leave the room because I went to the bathroom and they died. I had to go get something to eat and they died. Our biological needs that we have, and you come back and the person that you were sitting in the hospital room with died. So I know that other people feel that like I feel that. But I can't forgive those people that were sitting in that room. So it took me a long, long time. I'm still so angry about it. To not beat myself up for not being there. Because my choice was, I could go, and Christopher could be mad at me because he didn't want me there. And see, this is where I think he had a premonition he was going to die. Because why wouldn't you want your mother there? But he didn't want me there. And then on the flip side of that, if I'd have gone anyway and I'd been there, maybe. It's always maybe, right? Maybe I'd have noticed he had stopped breathing. Because there's never a for sure, right? Never. And he might have died anyway. Maybe the fact that they were in the room when he died, he would have died anyway. You just don't know. But it's that question of, if I had been there, that makes you go, I feel like I'm crazy sometimes. Because you want to go back so badly and change things. To change that moment that you think could have changed the course of where you are now, and change the course of what happened afterwards. So it's heartbreaking, really, when you think about it. It's that one moment that you think would have changed everything. And see, and this is where I think that the DSM saying that our grief is complicated, and the therapists out there that say grief is complicated, they don't understand this piece of it. They just don't. They think that there is some way that we can just turn this switch in our brain and we won't take that on. That somehow it was our fault. And there's nothing we can do about that. So how I have made peace with that is, and I don't even know if the word is peace, but if it was Christopher's time to not be on this earth, then it was Christopher's time to not be on earth, and there's nothing I could have done about that. And so I was doing some reading again, preparing for the podcast, and they talked about forgiveness. So the way to deal with guilt, they felt like, was forgiveness. So you forgive yourself for the mistakes. But I think it goes one step farther. I don't think it's really about forgiveness at all. It's about acceptance. That we have to accept that we were powerless, and we were powerless over the death. That there is nothing that we could have done, which means that we have to accept that they died. And then accepting that you were helpless over whether or not they died. That's the part that we really struggle with. We live in a world where we have control over almost everything. And there are some people that believe they have control over human beings. I see it every day in my work. They feel like they have control over human beings. But the reality is you don't. In some ways, I'm grateful that I am a therapist, because I learned long ago that I'm helpless when it comes to the decisions that my clients make, that my job is to sit there with them through the consequences, no matter what the consequences are. It's my job to be there with them. It is not my job to judge them for it. And so I was somewhat primed to accept that I was helpless over the death of my son. But it wasn't easy. It wasn't easy in any way, shape, or form. So if there's one word that I could give you that I think would help you, and let me be clear about this, you're going to manage your guilt. You're going to manage it. There is no magic pill. There is no magic therapy. There is nothing that's going to make the guilt go away. You are always going to have it. But you can move towards a place of acceptance and understand what the function of guilt is and in grief. And I really believe that the function of guilt in grief is that we don't want to accept that we are powerless over death. And that's what it comes down to. It comes down to feeling powerless. And we as parents are powerless when it comes to some of the decisions that our children make, even when they're young. Yes, we can control them, we can guide them, but even when they're young, they make decisions that we don't agree with, and we have to accept that. And that is the function of guilt when it comes to grief. So you need to explore your guilt, find out where it's coming from. In the next episode, we'll talk about how to use cognitive behavioral techniques to help you cope with some of the negative beliefs that you have about your guilt. But for now, I'd like you to practice radical self-acceptance, which is accepting the fact that you are powerless over grief and that you're helpless when it comes to the death of your child. That there was nothing that you could have done differently. And this is not going to be a popular message. It will not, I'm sure, make people angry all over the place. But the key to being able to carry your guilt in a way that you'll have moments of peace. I'm not going to promise that you will have peace always, but you will have moments of peace, is acceptance. So that's it for episode 6. Thank you for listening. If you would, shoot me an email, leave me a message on Instagram at Grieving Insomniacs, grievinginsomniacs@gmail.com. I look forward to hearing from you. I would like to hear your stories. I would like to hear from you. So please send me a message. I'm honored that you're here. Thank you for listening. I also have a book, The Solitary Journey of the Loss of a Child, on Amazon. Like and subscribe. This is Cristi Haberman. Have a good week.